All right, good evening, everyone. Let's get going. Settle in. Perfect. Awesome. Well, first of all, I just want to thank you all for being here. You know, you're spending one of your evenings with us, and that's one less evening you get in the future. And to spend it with us, we greatly appreciate it. Now, I feel a major responsibility in that I want you to get your money's worth tonight of your time and your money's value in your time tonight. And I know we're going to do that here tonight. So before we get started, I always like to start with a little joke. So we'll start here. This guy was talking to God. And, you know, when you can ask God anything, you think of some good ones. And he said, God, what's 1,000 years like to you? And God thinks about it and says, well, 1,000 years is like a second to me. And the guy thinks a little longer and says, He says, God, what's $1 million like to you? And God says, well, $1 million is like a penny to me. And so the guy thinks a little harder and he says, God, do you think you can give me a penny? God says, sure, just wait a second. Oh, yeah. Well, I'm Dr. Hunter Schultz. I'm the owner and sole chiropractor here at 920 Chiropractic Health and Injury Care. And, you know, I've worked on everyone from day-old babies up to 80-year-old grandmas with sore necks and everything in between. And, you know, over those experiences and hundreds of patient visits later, I've learned some things about health that I want to share with you tonight. So that's what we're going to cover in our short time here tonight is the 5 factors of health. And we're going to start in the beginning of life, okay? So, in the beginning of life, there's 2 cells, a male cell and a female cell. And those 2 cells join. And at that moment, there's this biochemical reaction, fusion of life energy that happens, and those cells immediately start to grow and multiply. Now they grow and multiply until they're about the size of a raspberry, sometimes called a mulberry. And I'll draw that in here. So about this time is when the first organ of the body is formed. And what is the first organ of the body? It is the brain. Everyone's so concerned with the heart, but it's actually the brain that is formed first. Now, this growing baby keeps growing and multiplying, and this mass of cells starts to get a streak in it, and the scientists see that this line starts to descend from this mass of cells. And of course, that is the spinal cord. Now, as this baby keeps growing, the scientists see that all these nerve fibers start coming down and out. Tens of thousands of them are coming down and out the body. And a lot of this is the cross patterning from left to right and right to left. So tens of thousands of all these nerve fibers coming down. Now, at the end of these nerve fibers, start to form little nerve buds. On each one of these, little nerve buds. And those nerve buds end up forming the organs. So let me draw that in a different color here. We got the heart, we got the lungs, we got the stomach, we got the digestive system, we got the kidneys, right? The liver, the testes, the ovaries, everything else comes from the brain and spinal cord system. Now, the body knows that this system is the most important system that it has. There really is nothing more important. So the body is very smart, and the body wants to protect this system. So what does it do? It forms a solid case of bone around the brain called the skull. Now, even the heart and lungs are very important, but they get a rib cage. They don't get a solid bone around the whole organ like the brain does. Now, the spinal cord is equally as important because remember, you sever your spinal cord in a certain area, you'll be paralyzed from that spot down, or you may even die. So the spinal cord gets its own casing of bone, but it's not one solid case of bone, because then we'd be walking stick figures and we wouldn't be able to bend and twist and do all the awesome things we get to do in life. So the body breaks it up into 24 tiny little bones called vertebra. All these little bones. So all these little bones are in our spine, and they protect the spinal cord. Now, the brain is what starts and ends life. The brain has 100% of all the life energy we need. Now, let me ask you, how much of that 100% power do you want getting out of the brain and down into the body? Let's say to your heart. Well, we want all of it, right? We want all 100%. How often of the time do we want that to take place? Well, all the time. For how long? Forever. And that's why we all go to the chiropractor, because we want this life energy getting down in the body at all times for all the days of our life. Now, these nerves and these bones, they are movable. The bones are movable. And they can shift and twist from everyday normal activities, let alone everything that we've done in our life, right? Like picking up boxes, picking up kids, long plane rides, long car rides, sports injuries, car crashes, stupid things we've done as a kid, friends pushing off the playground. All the things that happen to us in life cause those little vertebrae to shift and start to hit the nerve. And let me show you what that looks like here. We got a spine model here, and it shifts and starts to pinch the nerve like that. Like that. And this is going on all over our society today. I have this, you have this, your friends have this, your coworkers have this, but nobody's talking about this. We call this spinal subluxation. And this may be happening in 1 vertebra, 2 vertebra, 4 vertebra in your body. And that's my job, is to figure out where those are and correct that. So my job is to figure that out and tap that or adjust that vertebra forward over a series of repetitions to get that off the nerve so your body can heal up and you can have that life energy go down and out to all the important organs and tissues that nerve is going to. How important. So the scientists were so fascinated by this that they actually wanted to study this, and they did. So what they did is they hooked up a little light bulb. So let me draw my little light bulb here. They hooked up a little light bulb to the nerve, and the light bulb was lit by the nerve, because this is electrical. The brain and spinal cord system in nature is electrical. So the light started lighting up from the nerve, and they thought, how much pressure do we have to put on a nerve for the light to reduce in the light bulb? And so they did millimeters of mercury, which is a pressure unit, and they pressed on that nerve and found that just the weight of a dime on the nerve choked the power off to 60%. How important do you think is it to have full power, no pressure on the nerves going to the heart? Full power, no pressure on the nerves going to the lungs. Full power, no pressure on the nerves going to the stomach, to the thyroid, to the ovaries, creating hormones, to our blood vessels, to our kidneys that control fluid regulation. It is so important, and it is the foundation. So we have this system here, and let's go through the 5 factors of health. So number 1 is a sound nerve system, which we just talked about. Number 2, fuel. You need high quality food and nutrients to fuel yourself. Number 3 is exercise. You need to exercise the ligaments and muscles and tissues we have in our body. Number 4 is rest. We need high quality rest. And number 5 is attitude. We need a calm, positive, optimistic attitude. Now, it doesn't matter how good of food you eat if your stomach is working at 60%, because now the food is getting in the stomach, it's not being broken down properly, it gets in the small intestine and causes inflammation and problems. So it doesn't matter how hard you exercise if you're exercising on a messed up spine. All you're doing is wearing down those joints further. Just think about a race car. If you race the car and you race the car and you race the car and you never tune up the race car, what's going to happen? That race car is going to wear out much faster. And sadly, that's what most people's lives are like today. Now, rest. You're probably not going to be getting high quality rest if the power that made the body is not getting into the body to rebuild the cells, tissues, and organs. So, we want a great sound nerve system. You want to fuel properly and use those nutrients and minerals that you eat. Get your great chiropractic adjustments. If you want to exercise and feel better on an aligned spine, so you have more energy, better recovery, feel better overall, get your chiropractic adjustments. You want to get some high quality rest so the body can clear out the waste in the brain and rebuild the cells and tissues of the body. Get your chiropractic adjustments. And I can guarantee if these 4 things are in order, your attitude is going to be so much better because you feel better, you're functioning better, your work's probably going to be better, your energy is going to be better, you're going to have less brain fog, less pain. Everything in life is going to be better, and your attitude is going to be so much better. So that is the 5 factors of health founded on the principle of the sound nerve system, which is controlling and coordinate everything within the body. Now, that's the first concept that I want you to understand. And we're just getting started here, folks. We're giving you some high value stuff here today. Oh, good. All right. All right, let me check my notes, see where we're at here. Perfect. So let's go through this. Let's say you're 16 years old. You're just about to get your driver's license. You're so excited, and you're wondering what you're going to get for that first car. And your parents actually told you they're going to buy you your first car. And you're like, wow, that's awesome. But the caveat is you only get that one car for the rest of your life. So what kind of car are you going to get? Are you going to get a sports car? Are you going to get a truck? Are you going to get something with good fuel mileage? Are you going to get something with a good reputation? Well, let's say you get that car. How are you going to take care of that car? You're going to be hand washing it every single day, regular maintenance, regular oil changes. You're going to be vacuuming it out every week, wiping everything down. You're going to just take outstanding care of that car because that's the only car you're going to get for the rest of your life. Well, let me tell you something. We get our bodies, and we only have one body for the rest of our lives. And sadly, most people take better care than their car or their truck than they ever do their body, because we get our health and our body for free when we're born, most of us. So many people take better care of their car or truck because they had to pay a lot of money for it, so they value it. And that's super sad because our health really is the most important thing that we have. I mean, what do we have without our health? What can you do laying in a hospital bed getting chemo treatments? I mean, nothing is enjoyable. So that's the first example. The second example I want to cover with you is, let's say my finger here, my finger is a nerve. And we're going to wrap this rubber band around my finger. Not too tight, but just tight enough. Does it hurt me right now? No, it doesn't hurt at all. What about in a week or a month? What about years? You're probably going to lose that finger. Now, if we have this pressure on a nerve like this, is it going to help if we just massage it a little bit? Is that going to help? No, the problem is the pressure. What about if we exercise our finger a bunch? Is that going to help? No, might even make it worse. What about if I just take a bunch of pain pills? Well, I may not feel my finger then, but the problem is still there. That's where I come in as a chiropractor. I remove that nerve pressure off the finger or off the nerve, and that is how the body can then heal and function as it should. And no other profession deals with pressure on nerves like chiropractors. Now, the last example I want to give you is, let's say you have a car, great car, and you're driving down the highway and all of a sudden your check engine light comes on. You're like, whoa, it's kind of weird. That's never came on before. I should probably get something checked out here. So you pull into a mechanic shop and you say, hey, driving down the road, my light came on, my engine light. Can you check it out? And they say, sure, have a seat here. You sit in the waiting room. They take your car back into their shop. And they get back in their shop and they just look at the dashboard and they see the check engine light. So all they do is they take a piece of black duct tape and they just duct tape it right over the light. And then they drive it back out. They give you a bill for $150 and say, you're good to go. We got it fixed. Oh, awesome. You pay the money and you're driving down the highway. And you realize there's like something doesn't look right. And you kind of go and you feel and you see it's a piece of black duct tape. And you peel it off and the check engine light is still on there. And you're like, what the heck? Now you're just mad because you paid all this money and all they did was put a piece of black duct tape over the check engine light. And you're beside yourself, right? Well, many times this is what happens when people go get care in the medical system for symptoms. Okay? It's treating symptoms. They're putting black duct tape over your symptoms, not getting to the root cause and not checking the car or your body for the root cause. They're just covering it up. So I wanted you to understand that. Now, what is a symptom? Since we're talking about symptoms, what is a symptom? Draw that up here. Symptom. What is it? Some people say it's a warning sign. It's a warning sign of something wrong, right? Going on within the body. So we'll put that on here. A symptom. A symptom, which is a warning sign of something wrong. Now, when people have symptoms, what's the most common symptom that people go see doctors for? Yes, pain. Pain is a very big one. Now, when someone's in pain, what do they want more than anything? They want relief. Yep, they want relief. Now, what are some things that people do to get relief from symptoms? Yeah, they go with ibuprofen, pain pills. What about aspirin? That's another big one. I'll even go a step up and say get some opioids. A little bit stronger stuff for sure. Now, all of these things are just covering up the problem. Ibuprofen. Did you know 30 billion doses are given every single year or taken every single year in the United States? That's 88 doses per year per person in the United States, including children, infants, everything. 30 billion. That's 6,600 tons of ibuprofen every single year. And you know what? It kills 17,000 people every year. Aspirin's a little behind ibuprofen. 20 billion doses given every single year. Kills 13,000 people every single year. Now, opioids are a serious epidemic right now. And let me look at my notes here for some of these stats. They're just mind-boggling. 301 people per day are dying from opioids. And, over 50% of prescriptions given right now for neck and back pain are opioids. Something that I deal with all the time, naturally. 80% of heroin users get started on opioid prescription first. Now, this stat's really going to scare you. 1 out of 3 kids in an orphanage is there because either their parents are dead or they're in rehab from opioids. It's so sad. It's so sad. Oh, man. So these things that get relief over here they're really just deadening the nerve, deadening your pain receptors so you don't feel the problem. And now what do people think when they don't feel the problem? Oh, it's gone. It worked. It worked. Now, I'm asking you the question, did it just put a Band-Aid on it, or did it actually work on the something wrong, which is causing the problem in the first place? And that's the difference between chiropractic and all the other professions out there, is that we work on the something wrong or the root cause of what's going on. We don't just cover it up with different things like pain pills and muscle relaxers and needle injections. We work on the root cause of something wrong. So many times these patients, they'll go in for a checkup and they'll go to a doctor and get a consultation, an exam, maybe even some elaborate testing, and then the doctor comes up with a diagnosis. Now, what is the technical definition of a diagnosis? Most of the time, 95% of the time around there, a diagnosis is just a technical term for somebody with a symptom. So let's say this. Let's say you got a misaligned vertebra in the base of your neck, and it's causing you headaches. It's causing you a lot of neck tension too. So then you go and you say, well, I got a lot of tension in my neck and I'm getting these headaches. What do they call it? A tension headache. Now let's say you got that base of the neck vertebra misaligned and you're getting migraines with that visual disturbance and also nausea and maybe even vomit. We call that a migraine. Now what happens if you go in for low back pain? They call it lumbago, which just means low back pain, or everything. It's arthritis these days, so you probably got some arthritis. It's normal, and that just bugs the crap out of me. But so if you go in the medical doc for low back pain, what's going to happen to you? You're going to get put on pain pills, muscle relaxers. That stuff wears off. Needle injections, but you can only do a few of those because corticosteroid eats away the bone and causes osteoporosis. So you can only do so much of that. And then the next step after that is nerve ablation, where they freeze burn or heat burn the nerve to deaden the signals in it so you don't feel anything. I mean, you're literally purposefully causing damage to the nerve so you don't feel it. Now, you got to remember, those nerves in your low back go to very vital organs, and I wouldn't be freeze burning any nerve if I were you. Now, after that route, let me tell you, the surgeons are sharpening their scalpels for you because they have no problem cutting you open. And once you get a surgery, the low back surgery rates right now are about a flip of a coin if it's going to be good long term for you. Screws break off, they fuse the wrong segments that wasn't actually causing the pain, and a whole host of just messy things. Now, I could go on and on about this, but once they reach a diagnosis, the medical docs usually prescribe one or a mix of 4,700 different medications that are in circulation today. Again, they're covering up the pain, but not getting to the root cause of something wrong. Yeah. So, why did I get into chiropractic? What's my story? Well, I was about 18 years old. I grew up in Marshfield, Wisconsin, and I loved playing basketball. And it was my senior season, and my dream was to always play at the state tournament down in the Kohl Center in Madison. And we were about 6 weeks left in our senior season, and we had a good shot at going to state. We were number one in the state. I was their leading scorer, and it was just so much fun, and we had a good shot to make a run, right? And, well, on Valentine's Day, we had a game, and just before halftime, I was running down the court, and I heard a crack, and pain shot up my leg. And I didn't know what happened. I was done for the rest of the game. My foot hurt so bad. And the next day, I went to the medical doc, and they took x-rays, and they found out that it was a stress fracture in my third metatarsal. And so they put me in a boot, gave me some crutches, and I remember sitting there, in the doctor's office, and he came walking in and said, "Yep, you got a stress fracture. You're going to be out for 6 weeks, no exception." And I pleaded with him right then and there, but out the door he went. And so at that moment, my dreams and hopes of playing at the state tournament were just absolutely crushed. And I remember laying in bed that night, just crying, just upset, not knowing why it happened to me, not knowing what to do. Well, I got some sleep somehow that night, and I woke up the next day, and a chiropractor happened to be watching that game. And he reached out to my dad and said, "Hey, I saw your son get hurt last night. Bring him on in, and we'll see what we can do for him." I was like, okay. I needed a second opinion from somebody. I never knew what chiropractic was. I never went to one. And so I went into his office, and he explained how the brain and spinal cord system, like you just learned, controls and coordinates everything within the body. And so if you get pressure off of that system, especially the nerves going into the foot, you can have maximum potential and maximum healing. Now, he didn't guarantee me anything, but he said, "You know what? If we get those adjustments in your spine and we get that pressure off the nerves, you're going to heal up the best that you can." And I believed him. And you know what? He gave me some great adjustments, especially my low back adjustments. And to make a long story short, I was back playing basketball in 2.5 weeks versus 6 weeks. And I came back for the regional championship game, and we beat that team, and we went to the sectional semifinal, and we ended up winning that game, and we played at the sectional semifinal in Stevens Point, and we won that game to go to the state tournament. And I got to fulfill my dream playing down in the Kohl Center in Madison. And I have that chiropractor to thank for giving me my hope back, giving me my dream back, giving me that amazing experience I got to go through and be on the court and play. And he also changed my life. After that moment, I knew I wanted to go be a chiropractor. So I went to Marion University in Fond du Lac, Wisconsin, and I played basketball there and got my major in biology, so I had all my science credits. I then moved down to St. Louis, Missouri, and started chiropractic school at Logan College Chiropractic. And during those 3.5 years there, I learned as much as I could about the body, about chiropractic, about the best protocols for the spine. I went to 15 plus seminars when I was there, listened to a ton of webinars, talks, books, podcasts. I just got as much information as I could so I could come out and be the best chiropractor I possibly could to help so many people and give their health and hope back like that chiropractor gave me. So I graduated from that school December of 24, and I always knew I wanted to open my own practice. And I came to the Green Bay area, and my wife and I and our son at the time, we liked the Green Bay area, so we wanted to live here. And I found this space. And when I found the space, the outside of the building wasn't even done. In here was just gravel and the outer walls. And you know what? I looked at them and I said, I have a canvas to paint on. So I get to build my dream. And I drew the floor plans for this. I picked out everything that you see, put in a lot of work, and it turned out great. And now we have the space to help massive amounts of people with chiropractic. And I'm able to see just miracles every single day. And it's so rewarding to see those miracles happen from people getting better from back pain, from their digestive problems going away, their daily headaches clearing up. And to do it naturally just feels so good because we're not harming the body. We're not taking anything out of the body, nor are we putting anything in. We're just removing the interference so the body can heal up at its best. So why do I do these talks? I do these talks for 2 reasons and 2 reasons only. Number 1, it's so that you understand what chiropractic is, and most importantly, what it is not. And I hope that we've covered that here tonight. Number 2, I do these talks so that anyone in the community can get an affordable price to see how chiropractic can help them. Now, in my office, I see two types of patients. The first type of patient is the crisis-oriented patient, meaning they have to be dragged in here because they're in so much pain. And I always wonder, why do people wait that long to be helped by a chiropractor? So two types of patients. The first is crisis-oriented. The second is the few select-oriented people that are prevention-oriented patients. Now, these patients are so smart because they know it's better to take care of things along the way than to let it all go bad and wait to find out later on. Now, you see with the handouts there, we have the handouts and we have that yellow card at the top of the handout. I want you to take that and fill that out. Fill your name and your phone number at the top. This is going to allow you to book an appointment tonight and get a full exam, full consultation, any needed x-rays, and one treatment for absolutely free. Because I told myself that I would check anyone's spine for free so I could help them get their hopes and dreams back, and there wouldn't be a barrier to that. So fill your name out, fill your phone number out. That you will book your appointment tonight and get free of charge. Now, the other sections is where you can put your family, your friends, your coworkers, your teammates. Fill out their name and their phone number. You don't have to know if they want an appointment, but fill out their name and their phone number. And when we call them later, that will ensure them that they get that free first visit. Okay, so don't leave it blank. Help them fill it out and get on the schedule so they can get a free check of their spine. Good. All right. Before we close, I also wanted to do the drawing for the gift card. I'll shut the video off here and we will do that.